This is a presentation about the patient with a spinal cord injury in the dental setting.
What is a spinal injury? A spinal injury happens when there is a damage to the spinal cord, which entraps the communication between the brain and the rest of the body. Because of this, the brain cannot send or receive signal normally, so a person may lose movement, feeling, or both below the level of the injury. For example, if someone is in a serious car accident or fall from a high place, the spinal cord can be damaged, leading to weakness or even paralysis. The level of the injury is very important. A spinal cord injury can occur in the cervical, thoracic, or lumbar region of the spinal. If the injury is in the cervical or neck area, it is usually the most severe because it can affect both the arms and the legs. A thoracic injury mainly affects the chest and legs, while a lumbar injury usually affects the hips and legs. So the higher the injury is on the spinal cord, the more body function can be affected. That's why the level of injury determines how much mobility and independence a person is able to retain.
Dental hygiene management considerations for the patient with a spinal cord injury. You want to take into account the level of the injury of the patient. A cervical injury usually results in a patient either having no mobility from the neck down to being able to do small tasks with devices. A thoracic injury typically allows for shoulder and hand mobility, but it can be limited. This patient may be able to transfer on their own, but could also need help, and they usually will lack trunk stability. A patient with a lumbar injury may only be paralyzed from the hips down or could even walk with a walker or braces. Medications that can affect the oral cavity. Many medications that a patient with a spinal cord injury takes could cause xerostomia or may have several contraindications when it comes to dental treatment and anesthetics. The dental team would want to be hyper aware of any medications the patient is taking that could pose any risks in the dental chair. Appropriate appointment planning. When planning an appointment for a patient with a spinal cord injury, it is best to see them in shorter appointments to optimize patient comfortability, as well as morning appointments when they might have more energy. And lastly, access to care. This patient may rely on a caregiver to bring them to and from appointments, help them transfer, or the patient may not be able to work, which leaves them with no dental insurance, affecting their ability to seek and receive professional care.
Important appointment consideration. Before the appointment, it's important to carefully review the patient's medical history, current medications, and any special needs. This helps the dental team prepare for a safe and successful visit. Next, we should use the tell, show, do technique. This means we first tell the patient that what we are going to do, then show them the instruments or procedure, and finally perform the treatment. This approach helps reduce anxiety and allow us to adjust our communication based on the patient's level of disability. Another important consideration is patient comfort. Some patients use a wheelchair, so they may need assistance transferring safely to the dental chair. During treatment, we should make sure they are positioned comfortably and provide support with pillows or adjust the chair if needed. For example, a patient with the spinal cord injury may not be able to move easily or change positions on their own. Finally, communication with the patient's primary care physician is very important. If there are any medical concerns or if changes to the treatment plan are needed, we should consult with the physician to ensure the patient receives safe and appropriate care. Overall, careful planning, clear communication, and prioritizing patient safety and comfort are the keys to provide quality dental care for patients with a spinal cord injury.
Oral hygiene education. When you're educating your patient on oral hygiene, you want to recommend aids that are ADA friendly for adequate at-home biofilm removal. These can include a toothbrush with a longer handle or a larger handle for better grip, a toothbrush stabilizer, or a toothpaste stabilizer, or you could also recommend a flosser that has a handle on it for the patient. You also want to use disclosing solution. This helps the patient actually see the areas where they may be lacking or they're having trouble getting to. That way, when using the oral hygiene aids, you can teach the patient how to get to where they need to be. You want to educate the patient on retentive foods to avoid when brushing is not readily available. If a patient relies on a caregiver to assist them in brushing their teeth and flossing, and they're only able to brush or floss maybe once or twice a day, you want to let them know that retentive foods that are sticky or full of carbohydrates will sit on their teeth a lot longer, and maybe they should avoid this throughout the day until the afternoon or the evening when they or their caregiver is able to help them brush. You also want to review in-office aids, at-home aids, such as fluoride varnish and rinses that can build enamel strength for the patient between dental appointments. Fluoride is very important in helping build the strength of enamel, and this can help your patient reduce their caries risk in between dental appointments. You also want to educate the caregiver. If a patient does rely on a caregiver to brush their teeth for them or to aid in brushing their teeth, you want to make sure that they also are educated on how to properly remove biofilm at home to set the patient up for the greatest success.